Inspire V and Genio are the latest technologies available for people who cannot tolerate CPAP. If you've been diagnosed with moderate to severe obstructive sleep apnea and have found that CPAP or other therapies aren't working for you, you may be exploring alternative treatments. I'm Dr. Jordan Weiner, an ear, nose, and throat doctor in Scottsdale, Arizona, specializing in the management of obstructive sleep apnea. Today, we're going to compare the two hypoglossal nerve stimulation systems, Inspire and Genio. I've already made videos talking about Inspire and Genio separately, but I thought it would be helpful to make a video comparing and contrasting these devices. Both Inspire and Genio work by stimulating the hypoglossal nerve to move the base of the tongue forward. This opens the airway by opening the space behind the tongue, as well as pulling the palate forward and increasing tension in the side walls of the throat. Clinical trials for both devices have shown that they are safe and effective. Both systems have success rates of about 75% across clinical studies. However, Inspire has been implanted in many more patients, and there is more data regarding its safety and effectiveness, whereas Genio has only been available in the US since 2025, and as a result, we have much less experience with the Genio system. Both are generally covered as a standard benefit by major insurers, including Medicare, United Healthcare, Blue Cross, Cigna, and Aetna. Looking at the hardware, Inspire is a fully implanted system. There are two implanted components, the impulse generator with its internal battery and the stimulation collar with its lead. Before bed, you simply use a remote to turn on the system. There is a time delay so that you are already sleeping when the actual stimulation begins. With Inspire, the internal battery needs to be replaced in about 10 to 12 years. This is done as a short outpatient procedure. Along with the new battery, you will get upgraded to the latest technology. Genio is a hybrid system. There is only one implanted component, a stimulator with two electrode paddles. The stimulator is about 1 inch long and about 3/4 of an inch wide. It's as thick as 2 quarters stacked together. The impulse generator for Genio is referred to as the activation chip. The activation chip and its battery are worn externally rather than being implanted. The chip is attached to an adhesive patch that is placed on the skin just below the chin each night. The combination of chip and patch weigh about 1/2 ounce, less than the weight of 3/4. The patch is about 4 inches long and almost 3 inches wide. It feels like wearing a thick Band-Aid. The patches are free and shipped to your home. Your neck must be beard-free, and while rare, mild skin irritation is a possibility. We make sure you're not allergic to the adhesive by having you wear the patches before surgery. Genio's internal implant is theoretically a lifetime solution requiring no future surgeries. Device testing in the lab so far has shown device integrity up to 20 years. This may increase as the tests continue. The software and hardware upgrades are simple because the activation chip is not implanted. Surgery to implant either device is usually an outpatient procedure performed under general anesthesia. Inspire requires 2 incisions, each less than 2 inches in length. One on the chest for the impulse generator and the second just below the jaw for the stimulation lead. Because the neck incision is just below the jaw, most people don't notice it. Before the release of the Gen 5 model, the chest incision was placed right in the center of the chest. However, with the Gen 5 model, I can now place the chest incision and generator practically anywhere in the right chest. For many, I now make the incision just in front of the armpit. This has a couple of advantages. First, it's in a much less visible area. Second, there is more fat tissue there, which better conceals the outline of the device. For my patients who use rifles, I place the device lower and further away from the shoulder region so that there's no trauma from the butt of the rifle. Genio requires only a single 2.5 inch incision directly under the chin. The resulting scar is really not seen unless you tip your head back. Recovery for both is generally quick. Most people have mild discomfort and swelling for a week and return to work in a few days. You should not do strenuous activity or lifting for 2 weeks to allow healing. Complications can occur with any surgery and include bleeding and infection. Temporary tongue weakness and device malfunction requiring repositioning or replacement are risks for both devices. There are differences in how each system establishes the timing of hypoglossal nerve stimulation. Inspire synchronizes its stimulation to your breathing. When you finish breathing out, it goes on so that the stimulation starts just before you take your next breath. Studies show that this phase of breathing is when the airway is most prone to collapse, and Inspire has unpublished internal data suggesting that this timing is beneficial. However, published clinical evidence that synchronization is better is lacking. This issue is still debated. Genio is not specifically synchronized to your breathing. It stimulates at a regular rate programmed to your respiratory rate. It may not always line up with the beginning of each breath. We get questions about whether the non-synchronous stimulation of Genio might feel like you're fighting the device. Movement of the tongue has nothing to do with taking a breath. We don't normally move our tongues when we breathe, so there would be no sense of fighting the device when you breathe. Since both devices have similar success rates and high patient satisfaction rates, the difference in timing may not be important. Neither device tells you when to take a breath or affects the rate of your breathing. In terms of the reliability of these devices, with Inspire, there has been a 1 to 3% incidence of hardware failure. As a result, we occasionally have to reoperate to replace a component. With Genio, we don't have long-term data on component failure to compare to Inspire. Finally, for those who worry about back sleeping, both devices are effective. Studies of each device show that both achieved a very similar apnea reduction when sleeping on the back, around 53% for Inspire and 55% for Genio. Both do a better job, though, of reducing apnea when sleeping on your stomach or side. The criteria for who can be implanted with these devices is strict. For Genio, the apnea-hypopnea index, or AHI, must be between 15 and 65. For Inspire, the AHI needs to be between 15 and 100 for commercial insurance plans and 15 to 65 for Medicare insurance. In terms of body weight, for Inspire, your body mass index, or BMI, must be under 40 for commercial insurance plans and under 35 for Medicare. For Genio, the BMI needs to be under 35. A drug-induced sleep endoscopy, or DISE, is currently required in the US for both systems. It's performed while you are sedated so that we can see how the walls of your throat collapse. Neither system is currently used in the United States in patients with complete concentric collapse, although in Europe, Genio can be used in these patients. Complete concentric collapse is a circular collapse pattern in the upper throat seen in about 10 to 20% of patients. For these people, we currently look to other surgical and non-surgical solutions. In the future, we may be able to use these devices for this pattern in the US as well. In fact, Genio has just completed, but not yet published, the results of a study called the ACCESS trial, looking at their device in people with this pattern. When it comes to MRI compatibility, Genio has the edge. Inspire is currently approved for 1.5 Tesla MRI scanners, while Genio is approved for the more powerful 3 Tesla MRI scanners. Higher Tesla means greater tissue detail on the MRI images. This may be important if your doctor wants you to get a highly detailed MRI in the future. The big question is which one is right for you. Both Genio and Inspire are effective, safe, and life-changing therapies. The final choice truly comes down to individual preference. You might choose Inspire if you value total freedom and convenience with nothing to wear nightly and you prefer a long, established track record. However, there are trade-offs with Inspire. You'll need a battery replacement surgery in 10 to 12 years and are limited to a 1.5T MRI. You might prefer Genio if you want fewer internal components, greater ability to upgrade, desire a single incision surgery, and need better MRI compatibility. However, there are trade-offs with Genio too. You must wear a nightly adhesive patch and cannot have a beard under your chin. Genio has a shorter track record, and surgeons have less experience implanting Genio. Choosing Inspire versus Genio is an important discussion to have with your surgeon. If you have any further questions, please leave them in the comments section below, and don't forget to like and subscribe for more on Unmasked Beyond CPAP. For additional information about sleep apnea treatment, please also visit my website, weinersleepsurgery.com.